Hey there, congratulations. You're almost there. I know it's been a long process getting you prepared for bariatric surgery, but this is going to be a life-changing operation for you. It's going to make such a difference. We also know that surgery can be very anxiety-provoking, so we're trying to give you as much information possible to prepare you for surgery and get you ready. What that includes is this video, as well as the 4-page handout that gives you some pre-surgical information that's going to help you get ready for surgery. Now, the majority of you will need prior authorization from your insurance company prior to surgery, so that gives you some time to get ready for your operation. And let me just review some of the important things prior to surgery. Number one is the pre-surgical diet. You can start this anytime. Basically what it does is it shrinks the fat inside of your abdomen that makes surgery vision easier for me, so it makes a safer surgery for you. So we really want you to focus on this. We used to call it a 2-week surgical diet, but now we want to do it as soon as you can. It's never too early to start. So basically that includes 3 high-protein meal replacement shakes per day, plus 1 sensible meal, as they say on TV. We have some examples for you to follow, so I think that'll be very helpful for you. This may allow you to move your surgery up to an earlier date if you start this sooner than later. Now, the hospital will call you 1 week prior to surgery to go over any medications that you're on and to give you specific instructions about what you should take prior to surgery and when. Some medications that you definitely should stop prior to surgery, at least 2 weeks prior, are things like aspirin and Motrin and ibuprofen that could cause bleeding during your surgery. Other blood thinners such as Plavix or Coumadin and those type need to be stopped specifically by your physician. So make sure you speak to us if you are on those types of medications, and we'll give you specific instructions about when you should stop those medications. Now, 1 day prior to surgery, what we want you to do only clear liquids. This is pretty much anything you can see through. Now, we don't want you to do red dyes or purple dyes that may look like bleeding. So just stick to the clear liquids like Gatorade, Crystal Light, and that type of stuff, and that's 1 day prior to surgery. We also want you to do a bowel cleanse 1 day prior to surgery, and that's with a product called citrate of magnesium, and you can pick this up at any pharmacy. It has specific instructions on there, and you can also read along on your paper here for the instructions on how to take that. Now, very important, the night before surgery, we say NPO after midnight. Now, that's a fancy medical term for nothing to eat after midnight. Basically, we want your stomach empty prior to your surgery. So, no gum chewing, no smoking, nothing like that. Pretty much at midnight, lock the refrigerator, turn off the faucets, and just do your best to keep from eating anything. The day of surgery, you may have instructions from the hospital to take maybe an antihypertensive medication with a sip of water, just a tiny sip. And that's going to help control your blood pressure during your operation. So follow those instructions very specifically. As far as your time for surgery, the hospital will call you 1 day prior. Usually it's after 2 o'clock. That's to get all the schedule in line to make sure that everybody has the appropriate timing. If you have not heard from the hospital by 3 o'clock p.m., please give them or us a call to be sure we have you scheduled appropriately for your operation. One thing also we ask you to do prior to your surgery is a HibaCleanse shower. This is a medical soap that just helps eliminate any bacteria on the skin and decreases your risk of infection after your surgery. We have specific instructions where we take a HibaCleanse shower the day before your surgery. We sleep on clean sheets. Then the morning of your surgery, take another HibaCleanse shower. You can never be too clean. You can pick up the HibaCleanse at any pharmacy as well. And there's a specific sheet in your instructions about that. And finally, we just want to say congratulations. We're looking forward to working with you, and we are always here for you at every step. If you'd like further information on our VIP packages, which includes priority surgical boarding, valet parking, limited wait time in the office, please ask the staff. We'll be happy to answer those questions for you. Again, congratulations, and we can't wait to see you get healthier, losing weight, and feeling great about yourself. Thanks.